So welcome everybody. Okay. All right. So for those of you watching us live on Facebook, thank you and welcome for joining us. Today, for those of you that are watching the replay on YouTube or whatever other social media platform you are watching us on, thanks for joining us. If you are new to the channel, don't forget to subscribe and give us a like and share this with your friends. Today we are going to be talking about today's the topic of today's show is you just bought a home care or home health agency. Now what? These are five of the KPIs that every owner must own. Okay. All right. All right. So here we go. Let's take a look. All right. So whenever we are in home care, whether you're buying an agency or just starting out or however it is, we're going to specifically talk about what happens when you buy a home care or home health. All right. So the reality is that, sometimes people are just not great at keeping track of stuff. And when you buy one, you're buying you're buying just a wreck of an agency. Whether it be you're purchasing from someone else, or maybe you had a business partner that was out doing the day-to-day operations, and then they're taking over. The reality is, sometimes not having these KPIs, not having these numbers can ultimately negatively impact your business. So KPIs, not just for new owners, they're not just for external stakeholders or other people involved in the business. They help actually maintain accountability, and overall, they'll improve the valuation over time, even if leadership doesn't change. So it doesn't really matter what stage of the business you're in, doesn't matter where you are, but whether you just took it over, you're buying it, or you just decided you want to start new, these are the top five KPIs every owner should be tracking. First, first and foremost, I want to give a shout out to David. I'm so sorry. I don't want to mispronounce your last name, but I want to say more po. If I said that wrong, please forgive me. He asked this question specifically on LinkedIn, and we are going to go ahead and answer it for him today. So the top five KPIs, they are weekly billable hours. That one's pretty straightforward and it's self-explanatory. How many hours are you billing week over week? Is so that's going to tell you if you're tracking this persistently, it's going to tell you how your business is growing. How is it performing? Are you making money? Or are you not? The next big KPI that every owner should be tracking is your gross margin per case. So we always talk about the overall gross margin of your business. That's fantastic. Okay. You need to know how much money is coming in, how much money is going out. And for those of you that aren't familiar with gross margin, it's essentially the cost of doing business, your cost of goods sold. So in this case, in home care, we're not going around selling caregivers. What we're doing is we're selling the service. And the cost of goods sold is the hourly rate we are paying to our caregivers. Now, there's two schools of thought on this. Some people will take a true gross margin. What am I giving the caregiver versus what am I paying? Some people do an adjusted gross margin, which is what am I paying the caregiver versus how much am I charging, and then they factor in the employer burden. Two ways to look at it, whichever way is fine. Just understand that, when you do an adjusted gross margin, you're going to get a little bit lower number. And so some of the numbers they're throwing out um, at industry at industry level aren't always true to the top line. They aren't true to I'm sorry, adjusted gross, because there's too many variables depending on what state you're in, things like that. Now, the next is your client acquisition costs. That's number three. When we're talking about client acquisition costs, it's very simple. How much is it costing you to sign on a new client? So let's take a look at this. There's a couple of ways that we can figure this out. Okay, is number one is you're going to take overall how much are you spending on everything. So we could do this on a monthly basis, we could do this on we can annualize it, however it is. Let's say you have a salesperson you're paying 60 or $70,000 a year to, are and plus the employer burden. That's part of your cost. On top of that, let's say you're spending 500 or 1,000 or $1,500 on digital leads, meaning you're buying from Karen Homes, Place for Mom, caring.com, all of these other websites that do this type of service. And then beyond that, you're also doing a pay-per-click campaign. So let's say your overall annual expenditure is $120,000 a year when it's all in. Okay. So now let's break that down monthly. That would be $10,000 per month. All right. So if you are getting one client per month, then you are spending $10,000 per client. That's your client acquisition cost. So now, if in combined total, you are spending, you're getting 10 clients per month, that's going to reduce your client acquisition cost from 10,000 to 1,000. Now, mind you, I'm not using anybody's specific numbers. These are just easier numbers for point purpose of explanation as to what we're doing. So that the lower, the more volume of clients you're getting, the lower your client acquisition cost. It's not that difficult. That those are things that you really want to keep as low as possible. Now, I get the question a lot. Well, what is a reasonable client acquisition cost? That's really going to depend on what stage you're in the business and what your marketing mix looks like. How much of your marketing how much of your client acquisition is coming from, actual referral marketing? How much of it is it coming from pay per click? How much is it coming from word of mouth? So all of these things combined are what's going to determine whether or not you have a good CAC. Okay. Um, Without doing a full evaluation of your business and understanding all of this, we don't really know what you're facing. Okay. Now, the fourth KPI that every owner should be tracking is your caregiver retention rate. So if we take a look at the big picture, if you are, if you're doing like home care, you know, looking at private pay versus Medicaid. If you're doing home health or hospice, your retention rate, whether it's a nurse, a PT, an OT, whatever, all of this is still going to boil down to the same thing. Just the dollar amounts will change. Each employee you have, every field employee is going to bring you, and they have their own value. So if we're looking at home care, we're looking at an industry average of about $14,000 per client per caregiver. This number can increase greatly depending on whether it's private pay or whether it's VA or whether it's Medicaid or waiver. The number, the actual dollar amount varies. Same thing if we're looking at home care versus home health. You know the amount of money they're bringing in that they're generating per client will vary greatly. Okay, there's a number of factors involved in all of this. So the retention rate basically tells us the reason why we want to do this is because regardless of where you fall on the dollar spectrum, like how much is each field employee working for, how much is it worth to your company? The reality is the longer they're with you, the better the bottom line. So tracking your retention rates are going to tracking your retention rates, they're going to dictate your overall profitability. So the higher your retention, the more valuable your agency is. Plain and simple. It's really not overly complicated. Okay. There's a number of ways to track your retention rate, but overall, the formula is pretty simple. You take a fixed period of time. How many caregivers did you have to start? How many caregivers did you have at the end? And you take a look at this based on the new hires and at what point did they come in. Okay. Um, Again, if you have seeing a lot of turnaround, you've got a lot of issues that you need to address. And then the fifth KPI that we're going to discuss that every owner should be tracking is your compliance and or audit readiness. Okay. So basically it's like this. Um, are you in compliance or not? So if if you are in compliance, how often are you checking? If the state were to walk in, the state, the federal government, whoever it is that's doing the inspection, if they were to walk in and say, surprise, we need to look at all your files and we need to do a compliance audit. How ready are you at a moment's notice? So both of these compliance and audit readiness, all of this comes down to, on a scale of 1 to 10, how well do you think your team will do? And it's going to impact your overall daily performance. Because if you're compliant and you're audit ready, that means that you're going to have, very simply, a longer term, um, over the long term, you're going to have a more efficiently running business, because that means you have good systems in place. Everything is done in the right order. There's checks and balances in place. All of these things are going the way they're supposed to. This also means that for when it comes to sale of your business, it's going to increase your overall value, and it's also going to make a lot of the sale process more efficient. All right, it's you're going to avoid like deal burnout and things like this. So, and also a lot less surprises. So, we recommend that you do a compliance audit regularly, at least once a year. In the perfect world, you do it twice. You have people come in, make sure that everything is up to snuff. This is one of the things that our company does for like skilled agencies. We can come in and do this, and we can also audit your home care agency, depending on what's going on. All right, so those are the top five KPIs, but now what? So we know that KPIs matter. Even if you're staying on as an owner or if you're just doing a transfer of ownership or whatever it is that you're doing, we've now gone over the five KPIs you should be tracking, but let's be realistic here, okay? Um let's take a look at this. What happens next? Well, once we've determined that KPIs are important and we've determined, who should be tracking these KPIs, now what? Well, now we need to figure out who is responsible for what. You need to assign ownership to these KPIs. So if one owner is staying, or if you're the owner staying on, or if you're just coming in and you're just buying an agency or taking over and your management team is, you have to have clear accountability. All right, you got to understand which KPI each person should be directly responsible for. So, for example, okay, if I'm a large scale agency, or if I purchase a large scale agency, and I have two or three schedulers or care coordinators, I'm going to have one of them, like either my ops manager, client services director, whatever it is, or office manager, or even my senior scheduler. They may be responsible for tracking the weekly billable hours. They may be, my operations person or my HR manager may be responsible for my gross margin per case, because we know we have a fixed billing, and the variable is a lot of times the caregiver pay or the field staff pay. All right, so them you as the owner should know all these numbers, but they need to feel empowered to be able to go and get these numbers and self-report. It's one of the things I say a lot, especially during workshops when I'm working with people. The reality is, when we are um going over, you know, all the numbers, a little bit of shame goes a long way. Nobody wants to report that they're underreporting. And I know shame is a four-letter word, I get it. But the fact is, I'm not talking about humiliating anyone or making some belittling people. I'm talking about, you set a standard, you have your people track it, and let them know that they are underperforming. You shouldn't be the one to say this to people. They should know. There should be enough clarity and transparency so that we have fixed numbers and goals. And them tracking these KPIs, them being responsible and accountable for it, will help will help the leadership team better manage the people, because now the conversation isn't, oh, you're a loser, you messed up and you didn't hit your numbers. No, the conversation from your leadership team, including you, should be, hey, listen, I noticed that we are slipping on A, B, and C metrics. What can I do to support your success? See, that's the conversation that needs to happen. And this making people um, have ownership over these KPIs, making them be responsible for presenting these numbers, will allow you as a leader to be more effective, to allow you to be able to provide them the true help and support they need so that your team can flourish. Okay. Um, so that's basically it. And now, in terms of David's specific question, his actual question is, one of the owners is staying on. They don't have any KPIs. You know, um, so what do they do? Well, what happens when you don't have any KPIs? How do you set a baseline? Well, what you want to do um, is have a good understanding as to what the snapshot is of your business at the time. And that's one of the ways you do it. Well, if we know that we have a compliance readiness of maybe 6 out of 10, well, that's our baseline. This is where we know what we have to do. We can only go up from there. If our client acquisition cost is $800 per new client, well, then that's where it's going to be. If our gross margin per case is 18%, this at least gives us a starting point. Okay, and then we could see what, once we have that starting point for our KPIs, now what we're going to do is start creating these benchmarks. We want to go and we want to create a 30, 60, 90 plan to see what needs to be improved. And so over the first 30 days, what we want to see is we want to see, let's say, our client acquisition costs, we expect it to stay where it is. Over 60 days, we expect it to go down by 15 or 20%, and so on. And now, combined with our snapshot data plus our benchmarks that, for based on different assumptions and process improvements over the next 30, 60, 90 days, we can now start building out better tracked, more clear and concise data, and we could start seeing where the progress is. That's going to ultimately give us a snapshot, not a snapshot. It's going to give us a visual representation and allow us to better focus on what needs to be fixed. And finally, look, you can use Google Sheets. You can go and get different KPI dashboards. You can have somebody do this. What you want to make sure is that your cadence is right. Are you doing weekly, monthly, yearly, quarterly, whatever it is that you're checking these? Make sure you have your KPIs properly built out. You know, you want to make sure that the owner is always, or high level managers are always engaged without being overwhelmed. You want to make sure that you are aware of the data and that the right data is being tracked. So that's kind of where it goes. And this is where ultimately what we want to do in order to have properly aligned leadership with the strategic goals. All right. And that's basically where it comes down to. Now, I'm not going to go into all the ins and outs of building a dashboard on Google Sheets. That's a lot more than what I have set aside for this video. But there are plenty of great videos on YouTube on how to do this. You can also go to platforms like Upworks, Fiverr, and have people build them out for you. But these dashboards, just it's better to understand what it is. Now, we discussed, just to recap, 5 key KPIs that every owner should be tracking: billable hours, your gross margin per case, client acquisition costs, caregiver retention, and your compliance readiness. These these are just a few of what it is. Key thing to remember with KPIs are to figure out what are the most important. Don't try to track everything, but you do need to track enough to get a good pulse of your business. Remember, KPIs are fluid. What's an urgent in your business today may not be urgent in your business tomorrow. Understand this, get your processes improved, get your things in order, and have good systems in place. All right. Thank you all for joining us. This was a quick video. Just as a couple of key points here, we are moving the Saturday video because summer's coming up and I want to see my kids too. So we're moving the Saturday video to during the week. I like Wednesdays. I think it's a nice day, nice break in the middle of the week to what's going on. You let us know. Let us know in the comments below if Wednesdays work for you for the video release every week, or if you think Thursday or Friday will be a better bet. All right. So other than that, you guys have a great rest of your day, and we'll see you guys next time.